It's very important question. And interestingly, I do not have any preferences and leave it up to the patient by saying whatever you can tolerate. As long as there is sodium chloride, which is your table salt, and as long as you're consuming at least 5 to 7 grams for our young patients, some references say even go as high as 10 grams. If you have no hypertension, if you're a young person, you're welcome to liberalize your salt intake as much as you can. And that can be through whatever sources you tolerate. You know, some patients like to drink Gatorade. Fine with me. Other patients can tolerate Pedialyte, great. Yet, as you mentioned, some people complain that taking in a lot of salt causes nausea, in which case you want to pick those tablets that are enteric-coated with a coating that prevents their dissolving, you know, in your esophagus and stomach. Many brands are available. I have no stock in any of them, except to say you can also use a salt shaker. Take your salt shaker and add salt to your water. Some people are not able to tolerate salt tablets in any form. So at that time, I say take just simple salt from a salt shaker, add it to your water, add some lemon, add some cucumber, and drink this throughout the day. That way you end up consuming both fluids and salt. So that's the bottom line, easy. You're welcome to salt your food. Of course, salty snacks can be a very good way to boost your oral load of sodium and water. And you can pick pretzels or nuts or olives, whatever you can tolerate. You know, some of our patients have allergies and sensitivities, which is why I'm very liberal, and which is why I say whatever you can tolerate to get that amount in, that's fine with me. For our sickest patients with severe gastroparesis or severe swallowing, that is a big problem. You know, they're unable to consume enough fluids and salt, and that makes it very difficult, which is partially why their POTS can be out of control. Only in rare cases do I ever consider things like continuous or chronic intravenous fluids. I typically do not recommend a port or a PICC line, even though many of our patients, as you know, really feel better with intravenous saline. Long term, it's not a good option. Now, some of my colleagues don't use that at all under any circumstances. You know, I am more liberal on that. And sometimes these are necessary. For example, you can use them as needed. Typically, I use them when a patient with POTS experiences a significant deterioration following a viral illness, like the flu, like the coronavirus, like a GI bug, in which case I will refer them to get IV saline, and that typically helps them to feel better. And a special consideration should be given to our patients with Ehlers-Danlos and dysautonomia who have severe dysphagia or swallowing dysfunction, or severe gastroparesis where they are unable to consume that much fluids and salt. We have to be cognizant of that and make special arrangements for these patients. But in the vast majority, try to utilize them only on as needed basis and try to consume all of your fluids and salt orally.